keeping some of these cautions in mind about making generalizations and keeping local context at the forefront, let's think about some of the challenges that seem to disproportionately affect rural communities and challenges that have a direct impact on young people. So let's start with poverty. We often think about poverty as an issue that principally affects cities, and yet it often comes as a surprise to people when they learn that in this country, non-metropolitan poverty rates have always been higher than metropolitan poverty rates. And I often point this out in talks that I give. In fact, only central city poverty rates are higher than non-metro rates. So this is an issue not only for institutional capacity, but also in terms of the student populations enrolled within rural schools. So Streams and colleagues, for instance, note that among the 10 states with the highest incidence of poverty, 36% of students and 57% of school districts are located in rural areas. Over 26% of all children in non-metro America currently live in poverty, an increase of about 4.5% from just 5 years ago. And it's not exactly a news flash that poverty is also tightly linked with a host of other risk factors. In rural areas, this might manifest in several different ways. And one is drug abuse. And similar to poverty, we often think about drug abuse as an urban issue, but closer examination suggests that, again, this is not a warranted conclusion. So while a few years ago methamphetamine was really a major concern in a lot of the communities in New York and certainly in Pennsylvania and across the country, it seems pretty clear that this is becoming supplanted by prescription opioid abuse and increasingly heroin, which has become prevalent. So a recently published study using nationally representative data found that 8.6% of rural youth had reported prescription drug abuse within the previous year, and that's in contrast to 6.5% of urban youth. State and federal officials have in a variety of ways also clamped down on prescription opioid abuse, including FDA approval of abuse-deterrent forms of prescription painkillers. And as a consequence, the availability on the black market has gone down and the price has gone up. And as this has happened in many places, heroin has come in to fill the demand from addicts who can no longer afford and who no longer have ready access to prescription painkillers. You know, when I was growing up in D.C., it was at the, I lived probably 2.5 blocks from Walter Reed Army Medical Center, and a lot of the Vietnam vets were housed there, and a lot of them had addiction problems and heroin addiction problems, and so I always associated heroin problems with the inner city and with and specifically with my past, thinking about the problems with returning vets, now these days I live in a small town, probably 1,200 people, and we absolutely have heroin in our town. I know a couple of people who are in rehab. We had to deal with a guy a year or so ago who passed out in our yard, and this is a small rural town. Heroin is cheap and available. In Pennsylvania, a bag of heroin can be bought for approximately the cost of a pack of cigarettes or a 6-pack of beer. And Pennsylvania is not an outlier. Childhood obesity. We often assume that rural areas provide lots of opportunities for physical activity and healthy outdoor activities. However, children living in rural areas are about 25% more likely to be overweight or obese than their peers in metro areas. So rural communities often face unique challenges when it comes to obesity prevention. Geographical distances between home and opportunities for physical activity and healthy eating can place a time and cost burden on families. Rural areas often have much more limited private and public health care opportunities that provide access to childhood obesity interventions. So compared to children in urban or suburban families, rural youth face lower access to health care, lower levels of physical activity, poorer quality food, and limited options for transportation. So these challenges, along with the challenges associated with the high rate of poverty in rural areas, can make it difficult to implement some of the healthy and active living changes that are often recommended by childhood obesity prevention literature. And then we have a number of processes and factors that we might generally categorize as rural community decline. Now, before I get into this, we established earlier that rurality is exceptionally diverse. And the same holds true for the economic conditions in rural America. Some places are doing quite well with healthy, diversified economies, and some places are gaining population and attracting wealthier immigrants. And here we might think about rural retirement destinations or places that have high amenity recreational opportunities or that are finding other ways of achieving economic and social vitality. But in many places in rural America, this is just not the case. I was doing a study some years ago on rural youth aspirations, and this is the study that I was doing these focus groups for, and I was at a site in northern Maine talking with students and community members and educators about the rural school and community well-being, rural youth aspirations, and this was an area that was completely decimated by the collapse of the logging industry, literally had no economy to speak of whatsoever. Families were taking in foster children to boost the enrollments in the school so that the school wouldn't close. I went down to Bangor and visited with a friend of mine, and he had a friend of his that was over from that area, and his friend said to me, "Oh, you got to tell those people, you got to tell those young people, they got to leave. They got to get out of there because there's nothing there for them. That's the best thing you can do is tell them to leave." And I'll never forget, shortly after, come to Pennsylvania, to Penn State, speaking to a rural superintendent who told me flatly, "My job is to give the students I work with the knowledge and the skills they'll need to be successful elsewhere because there are no opportunities for them here." That is a stunning statement. My job is to give the students I work with the knowledge and the skills they'll need to be successful elsewhere because there are no opportunities for them here. So anyway, communities like these are characterized not only by stagnant economies, but by shrinking and aging populations.